Hello and welcome to a brand new episode of the Daily Debate. My name is Ahmed Nader and tonight we're going to focus on the health sector under the tenure of His Excellency President Abdel Fattah al-Sisi in the past decade, as we will be looking forward to more development and to be having better services for the citizens to be offered in the upcoming years under the tenure of President al-Sisi in his new term. We will be first of all starting with the main top story for today. But first of all, I'd like to say thank you for Mr. or Dr. Islam Anan, the lecturer of the Health Policy and the Health Economics at Ain Shams University, for being with us tonight. Thank you very much for being with us.
Thank you. My pleasure. Always a pleasure, Mr.
Anytime. The pleasure is all mine. We will be starting with the main top story for today, which is related to the main topic of the health sector for the daily debate for tonight, as President Abdel Fattah al-Sisi on Sunday followed up on the governmental efforts to support the private sector's contribution in the investments in the sector of health and to boost the health investment flows. This came at a meeting with the Prime Minister Mustafa Madbouli, the Minister of Justice, Councillor Omar Marwan, and the Minister of Health and Population, Dr. Khalid Abdel Ghaffar. Presidential spokesman, Councillor Ahmed Fahmy, said that the meeting reviewed the mechanisms of following up on the commitments by the investors to establish, develop, run or operate the health facilities. The meeting discussed the legislative frameworks needed in this regard in order to boost the capabilities and the capacities of the health facilities and to elevate the quality of the provided services in general. During the meeting, al-Sisi was briefed on the achievements in a number of national mega projects in the field of health and the steps to support the national pharmaceuticals industry. And before heading to the first topic and the first report of the daily debate for tonight, I would like to ask Dr. Islam Anan regarding the top story for today and the presidential activity of His Excellency President Abdel Fattah al-Sisi, a meeting with the Prime Minister Dr. Mustafa Madbouli, with the Minister of Justice and the Minister of Health and Population as well, Dr. Khalid Abdel Ghaffar, regarding the contribution of the private sector in the health sector. How do you see the importance of such a step?
So that's a very good topic to start with, because it's a very important to tackle the public-private partnership, because if we are tackling healthcare industry in general, the most important thing is financial sustainability. And if we would like to achieve the healthcare coverage for all Egyptians, we're talking about a population over 100 million, it will be a very hard case to be covered only by the public sector. And all countries, and we can take a lot of Western European countries, taking the same technique, which is involvement of the private sector in the reimbursement and the insurance coverage. So Egypt, starting from 2018 and the launch of the universal health coverage, it was a very ambitious plan that just in 10 years we would like that all Egyptians to be covered. Achieving that, we need a good infrastructure of service providers, as you mentioned in the introduction. And we know that 10 years ago, the health expenditure was like 60% out of pocket and 40% only from governmental sector. And if we'd like to achieve 100% from the public sector, we need to involve the private sector underneath the umbrella of the public insurance. Doing that, we need to involve them as hospitals, service providers, and that was the launch of the universal coverage since 2018 to make sure that private hospitals can also have the right to be involved to treat Egyptians, but on the expense of the state, on the expense, governmental expense. And we've seen that in Port Said, we've seen that currently in Suez, in Luxor, and in Sinai, the 5 governorates reaching the universal health coverage. And as we can see, they are treating with the same premium, same amount of money that the governmental hospitals as well are treating. And since we are talking financial stability, we need to achieve that the private hospitals can give us the same service fees of the governmental hospital, and it's not easy. It came after a lot of negotiations, after a lot of health coding with the private hospitals, and since we are talking service providers, we can as well talk about the pharmaceutical sector, as you mentioned, to make sure that we are procuring the pharmaceutical medications with the most efficient prices that can be sustained all over the chronic diseases and the acute diseases for citizens. These are the two main aspects of the private involvement, the pharmaceutical companies' involvement, the private sector, and the private hospitals' involvement in service providers. These are the two milestones that have been achieved since 2018 so far, and it will be continuing till 2030 and the achievements of the universal health coverage.
But for the Egyptian citizen, someone who is listening to such a topic and the idea of having more contributions from the private sector into the field of health, in the sector of health, how can this be affecting the quality provided of services to the citizens and the costs as well? Because we know that the private sector wants a return on the investment. Yeah.
To start, I will start with a very important thing, which is the centricity of healthcare. For healthcare, we do have a lot of centricities. Egypt adopted what we call citizen centricity of healthcare. It means that the main core of the healthcare is the citizen himself.
Yes.
We need to achieve a good quality of life for citizens, and they can go to private hospitals as well as having the right to go to public hospitals, of course. To do that, you need to make sure that the quality is actually standardized between the public and the private sector. Hence, GAHAR was established. GAHAR is an authority established by the President Abdel Fattah al-Sisi to make sure that we accredit private hospital as well as public hospitals for the sake of the main topic, which is competition. If you can achieve competition between hospitals, you will achieve better quality service and you will achieve that patients got the right to go to both hospitals. What will make Egyptian citizen go to a public hospital and he got the right to go to a private hospital, making sure that he will receive the same quality. And since the public sector as well will be dealing for profit, as if it's a for profit, they will be enhancing the services, enhancing the quality of services and the satisfaction as well. So having a competition in place, this is the main target for the President Fattah al-Sisi and Professor Dr. Khaled Abou Ghaffar to make sure that we can achieve the sustainability we were just tackling a minute ago. And one important topic for that is, if you can make sure that the competition is there, you need to make sure that the procurement is sustained, as well as from the private sector, pharmaceutical sector. Hence, a unified procurement authority was as well established in 2018. You do have currently a UPA. UPA is Unified Procurement Authority, established in 2018. You have the GAHAR to make sure the quality is sustained, and hence you do have a nationwide coverage for the healthcare sectors. These two main authorities established were actually the cornerstones of having the UHIA. I know a lot of abbreviations. Universal Health Insurance Authority. This is the new authority that will replace all the health services by 2030 to ensure that the citizen got only one insurance place. Before that, we do have, for example, health insurance organization. We do have on a state fund insurance. We do have the private sector. We do have the GOSI insurance. We do have a lot of insurance bodies, and the multiple insurance was always for the citizen is actually what's my insurance gonna be? How can I go to a hospital? Will they reimburse me for free? But currently, the new governorates entering the universal insurance, they do have one insurance body. They just take it on a household. They do have one card, and the card will be complemented by the private sector, so it will be easy for the citizen, which is the main aim, as I was saying, citizen centricity. We need the citizen to easily go to any hospital, get their treatment in a patient journey, what we call a very important abbreviation here, the TAT, turnaround time. They do have a very fast access to treatment. They can go to the reach for their treatment, achieve their satisfaction from whatever they are going to a private hospital or a public hospital. All are the same governance. The health governance is a main topic for that, and to integrate all the sectors we were just mentioning in just one health. The citizen will not going to be disturbed with all the abbreviations I've said. He was only focusing that I do have my national ID. My national ID number will facilitate for me to go to any hospital and get my treatment for free. That's the main aim.
Yes, Doctor, my final question before heading to the first report of the daily debate for tonight, because we have seen a number of mechanisms being discussed between President Abdel Fattah al-Sisi and the attendance of the meeting for today involving the Prime Minister and the Minister of Health as well, is to be having the private sector establishing, running, developing and operating health facilities. I would like to focus on the word of developing, because in my opinion, I think that this has a lot of costs around it in terms of money. If you establish one health facility, it would be easier to be establishing and running and operating with your own terms as the private sector. But in terms of developing, how hard is it to be developing the already running facilities for the citizens? Because we have seen over the past decades deteriorating health facilities being offered for the citizens. Is it more harder? Is it more effective in terms of cost to be developing what we have, or is it easier to be establishing a whole new facility, health facility for the citizens?
That's a very good question. So I always like the term facelifting. So the capacity building and facelifting to the existing infrastructure of healthcare is an efficient way. In healthcare, it's better to build on whatever infrastructure you are having, not to build it from scratch, because we do have the hospitals. And building a hospital is not just a normal building. It got a lot of engineering techniques. So since we do have the building itself and it's already made up to the standards, we just need to facelift it. You need to make sure that it's operating under the quality standardization and the quality accreditation of the Gahar authority we were just mentioning, and to make sure that it's up to the level we are seeking for the Egyptian patient or the Egyptian citizen, because the healthcare we're not going to be serving only patients. We will be serving citizens, like in presidential initiatives, for example, for screening, for general checkups, for vaccination, and so on.
Yes.
So the facelifting, it got a lot of attributes. The first is the IT infrastructure, and hence we do need the technology transfer of the private sector. They do have the know-how. They got a lot of advancement than the public sector, to be honest, in the IT and in patient coding, for example, to making sure that, for example, if a patient is going to a hospital and on the other visit he went to another hospital, we can track his visits. This is a very important one, and hence automation, digitalization is important. That's the first thing that we need in facelifting. Another one is a human capacity building.
Yes.
We need to make sure that all the healthcare professionals and technicians are actually trained in the new facilities by the private sector on how to operate, on how to serve the patient in a satisfactory way, how we can get and actually generate satisfactory reports every month or every 3 months to compare that we are actually achieving the satisfaction we are seeking. So these are the infrastructure. Another one is the health indicators. For private sector, and we were just mentioning, in 2010, for example, the budget for healthcare all over from governmental expenditure was about 35 billion Egyptian pounds. Currently, this year, we are talking about 158 billion Egyptian pounds in the new balance of the Ministry of Finance. So it's a big leap in terms of budget, but still we do need a lot of private sector contribution in terms of investment that can actually help in achieving the gap of the 60% out of pocket we were just mentioning.
Yes.
And having the IT, having the financial sustainability, having as well human capacity, and having by the end the health indicators. Health indicators means the outcome, how good looks like, what we like to achieve. For example, just to give one example, if an operation or a surgery is achieving worldwide a 90% success rate, we need to make sure that in Egypt it's not below 90%, it's above 90%. Achieving and actually putting a lot of key performance indicators, KPIs, what we call in healthcare health indicators, is very important. The private sector will augment that. It will integrate with the public sector in putting what we call an integrative comprehensive healthcare that can achieve the resources we mentioned, the processes we mentioned, and the outcome, which is the most important one.
Yes, Doctor, allow me to be going to the first report of the daily debate for tonight, which focuses on the upcoming term by His Excellency President Abdel Fattah al-Sisi as president, and focusing on the developments that took place under the tenure of President al-Sisi in the past decade. We'll be having more details regarding such an important topic in the upcoming reports. Stay tuned.
Health, education and infrastructure saw remarkable progress, prompting the electorate to renew confidence in President Abdel Fattah al-Sisi. Some of President al-Sisi's great achievements over 10 years he has to carry on in his new term. President al-Sisi's sweeping victory in the latest presidential elections came as no surprise due to achievements he made in the past 10 years in the office of president. These achievements cover almost all walks of life in Egypt. Developing the health sector has always been a top priority for the state since President Fattah el-Sisi took over about 10 years ago. This has been evident in the rise of public spending on health to £222 billion in fiscal year budgets 2022-2023 compared to £32 billion in 2014. Several initiatives have been carried out to care for Egyptians' health and improve quality of their lives, topped with 100 million healthy lives initiative and 100 healthy days, which have benefited millions of people all over the country. The initiatives covered elimination of hepatitis C, early detections of non-communicable diseases, maternal health care, early detection of genetic diseases in newborns, early detection and treatment of hearing impairment for children, early examination of anemia and obesity for school students, follow-up of women's health and treatment of chronic diseases, early detection of kidney disease, and ending waiting surgery lists. The government offers comprehensive health care by improving medical services in all state-run hospitals and medical facilities. Last October, the World Health Organization awarded Egypt the gold-level certificate for eliminating hepatitis C, a chronic viral infection that affects millions of people worldwide. Egypt was the first country in the world to receive this certification after reducing its infection rate from 14.7% in 2015 to less than 1% in 2021. President Sisi always stressed the prime importance that Egypt attaches to the issue of food security, and many projects have been implemented in the sector over the past years. One of the major projects in the mega national one of the New Delta, which aims to reclaim 1 million fadans and provide over 200,000 various job opportunities. Over the past years, the Ministry of Supply and Internal Trade launched major national projects that led to enhancing services provided to citizens, preserved the strategic stock of all basic food commodities, and provided thousands of job opportunities through the establishment of logistics and commercial zones. The two leading initiatives, Hayya Karima and the Careful and Karama projects, have been playing a key role in state efforts to better services and achieve food security by developing Egyptian countryside and securing livelihoods for scores of millions of Egyptian people. The ministry has also launched a broad national project to establish 7 giant strategic food warehouses in collaboration with the private sector, with the aim of increasing the stock of basic goods and providing the people's needs throughout the year. Energy, electricity in particular, has always been a national security issue in Egypt, and over the past 10 years it has experienced an unprecedented boom thanks to strong support from President Sisi. Mohammed Shaker, Minister of Electricity and Renewable Energy, said that new service stations have been established and existing were developed, and an additional 29,000 megawatts were added to the national grid, bringing the total to 56,000 megawatts. Egypt aims to reach 60% dependence on renewable energy by 2040, an update to the previous target of 42% by 2030. In the meantime, Egypt has signed a number of deals with an international alliance for the production of green hydrogen and its derivatives in the Suez Canal Economic Zone. The country is seeking to become a global hub for green hydrogen production. Egypt also is seeking to reduce emissions and develop the use of renewable and alternative energy sources over the coming years, including green hydrogen as part of its National Climate Strategy 2050.
Welcome back. You're still watching the Daily Debate, and I'm honored to be having with me over the course of the episode for tonight Dr. Islam Anan, the lecturer of health policy and health economics at Ain Shams University. Thank you very much once again for being with us tonight. As we did see in the past report, a lot of achievements in different sectors over the past decade under the tenure of President Abdel Fattah el-Sisi. In your opinion, what were the topics and what were the sectors that were prioritized by the state to be developing in the past 10 years?
So I really like the report, and I totally agree that it's unprecedented that we achieved a lot in terms of primary protection, in terms of screening. And as we were just mentioning, 10 years ago, we were just treating patients. That was the main aim of healthcare. Currently, the main aim is citizen health, by citizen health that I don't just want to treat patients. I need citizens not to be patients. And that's the main difference between citizen centricity and patient centricity. Yes. And if you are talking about the presidential initiatives for health, for example, the 100 million healthy lives and unprecedented screening for hepatitis C, for example, it's an achievement that it's a Guinness record achievement. We screened 50 million Egyptian citizens for hepatitis C. And hence we reached a 1% and less than 1% hepatitis C infection in Egypt. And we were 10 years ago the first country worldwide having infections from hepatitis or chronic hepatitis. And having said that, it got another term for economic prevention as well, because elimination of virus C is not just only clinical. Of course, the quality of life is very important. We are saving lives, and actually we are saving the economy as well, because every pound we spent on the virus C elimination plan, we saved 3 pounds in the economy from the late stage diagnosis, from the late stage treatment, and from the banning of the Egyptians want to actually work abroad, and they are banned from working abroad because they got hepatitis C. As well as we actually decreased the percentage of hepatocellular carcinoma, the liver cancer. You know, hepatitis C is the main precursor of liver cancer. Another one also mentioned in the report, and very important, that presidential initiative is, it got a main aim, which is the citizen journey. So we got a presidential initiative for mother and fetus. So even before delivery, we are checking with the mothers for a lot of viral infections, making sure that there is no any viral infection like HIV, like HPV, and if so, they got their treatment for free. And we screened so far 2.5 million mothers for that. Then after that, we do have the genetic testing presidential initiative for newborn. The newborn screening is very important. We are screening all and every fetus after delivery if they are admitted to the ICU for any genetic disorder. We are screening 19 genetic disorders, and once it is diagnosed, it's treated at first month or second month. And if we are not doing that, we would have actually discovered that a lot of years after, with a lot of cost and a lot of clinical burden and consequences. Then we take it from there. For example, another prevention initiative for school-age children, for obesity, for stunting, which is short stature, and for anemia. And this presidential initiative is very important because we are tracking school children every year. So imagine every year, Egypt is screening 10 million school children every year to track the 3 syndromes: obesity, short stature, and anemia. And if you can look at the trend from 2018 till this year, you will find that, for example, anemia and short stature decreased in incidence. Obesity will still do have some stagnancy in terms of percentages, and hence, once we see in a presidential initiative that there is a result that we need to address, there is another presidential initiative for nutrition, for food and nutrition. We need to make sure that the school children are getting fed with healthy meals. Hence, there is a school meal presidential initiative, for example. And we take it from there. Non-communicable diseases like diabetes and hypertension, the screen 25 million Egyptian citizens. And for senior citizens, for cancers, we do have currently 5 cancers are screened. So you are taking all the journey of the Egyptian citizen from birth till senior citizenship to make sure that we are actually preventing diseases, not just treating. We're not just waiting that the patient will present to the healthcare facility with a late stage disease. So just to give you an example, in breast cancer, for example, most of the breast cancer patients were actually presented on a metastatic state. Metastatic, it means it's a terminal state. Most probably they will end in fatality. And it was like 60%. And because we are screening women, currently we screened, for example, 20 million. Then the year after, it was 30 million. So we reached 35 million visits for breast cancer. Currently, we reversed the percentages. It was 40% before metastatic and curable, and 60% metastatic. Currently, it's only 40% on metastatic state. So we are downstaging the cancer stages, and hence we are saving lives. Again, from economic perspective, every pound we spent on breast cancer prevention, we saved 1.35 pounds. So we do have clinical implications, we do have quality of life implications, and economic return as well.
On the other hand, in your opinion, what are the sectors that should be focused on, that should be prioritized by the state in the health sector for the upcoming period?
So if we are focusing till 2030, we need to focus and augment more the health policy and public health, like the current Ministry of Health administration is actually doing.
Yes.
So a lot of focus and a lot of budget was actually put for primary prevention. Primary prevention, it means no disease at all. We need to screen people to prevent disease. It's like stunting. It's like smoking cessation campaigns. So all the public health campaigns. And then the secondary prevention, it means early detection. Instead of detecting the diseases in late stages, and it got a lot of precautions for clinical and economic, we need to discover it early. And last but not least, the most important one is tertiary prevention. It means if the patient reached a late stage, diabetes, hypertension, cardiac diseases, we need to make sure that they got their treatment from optimum perspective. These are the three main aims of the Ministry of Health. The private-public partnership is actually very important. We are actually increasing that. So we are going to the right path that by sustainability and financial sustainability and all the challenges that we were facing last year are currently, alhamdulillah, solved after having a lot of liquidity in terms of USD liquidity to make sure that from pharmaceutical sector, we do have sustainability. From health providing, we do have investment, as you mentioned in the introduction.
Yes.
So all these pillars, to continue in that and continue in their sustainability will make sure that, inshallah, we will achieve 2030 vision for health, having all Egyptian citizens covered for free on a household level and having their reach to medical treatment on an easy, accessible way.
Over the past 10 years, we have seen statements by the government and the cabinet and Prime Minister Dr. Mustafa Madbouli saying that we have invested and we have pumped as a state about 4.9 trillion Egyptian pounds in the mega national projects in general. Yeah. How do you think this has affected the health sector in a positive way? As before the break, you mentioned, for example, the digitalization of the information and the data for the benefit of the citizens.
Okay, so all the time and in most talks we were faced that if you invest in healthcare, you are investing in a consumable industry. Yes. We just consume money, we just consume resources, and there is no measurable returns. That's actually very incorrect and was proven incorrect by the Prime Minister and the administration, because every pound you are investing in healthcare, it got a lot of return on investment. In a very nice study, they measured that every dollar you are spending in healthcare, you got a $3 return on investment. So in mega projects, investing in healthcare, it's a very important pillar in the improvement. Another sector is, it's not a consumable ministry or industry, it's actually productive. It produces the most important product in any country. It produces health. Yes. If you do have a good health, you do have good economy. If you do have poor health, you're not going to be having a good economy. And we do have COVID as a witness for that. Most of the people were actually off work. There is no productivity. And we've seen that the world lost in 1 year around 1.5 trillion US dollars just from the productivity lost. Just productivity lost. Not mentioning...
Not treating the patients.
Not mentioning the treatment, the vaccination, all of this. So it's very important that currently we are focusing, and then the previous 10 years we launched a lot of mega projects. The Universal Health Coverage Project is one of them. It's a mega one. And we do have a lot of hospital built. We do have a lot of authorities. And we can say that all of these are under a big umbrella called health governance, having all authorities, the new authorities built, all the authorities built together in digitalization, having them in automation to make sure that, for example, if we are procuring any medication, that the patient will receive it in a timely manner. We're not making governance to make the turnaround time for patient elongated. We would like to have it shortened. To make sure that we are having that, we need a mega digitalization for the system. We need a mega automation. And to make sure that the governance is actually done in a timely manner.
Yes, Doctor, you have mentioned before the break as well the elimination of hepatitis C here in the country, according to one of the presidential initiatives by President Abdel Fattah al-Sisi. And one of the statistics says that we have the infection rate decreased between 2015 and 2021 between 14.7 to under 1%. Yes. That's quite an achievement for Egypt and for any other country in the world. What does this say about the priority of health for the state, about the determination of the political leadership to be having health upon top of the agenda for itself?
So first, it is a success story,
Yes.
and a lot of stars from the ministry and all from the other ministries as well do have the public health and the public health initiatives administration inside the Ministry of Health, for example, a lot of achievement, because you would like to launch a program that will reach 50 million citizens.
Yes.
It's not an easy one. That's, again, a Guinness record screening number.
Yes.
No other country achieved to screen 50 million citizens. Another thing is how you're going to make sure that the citizens will have the confidence to go to the health facilities and the primary units to make their actually screening. And hence another success for all the peripheral units who are actually encouraged in the primary care units, citizens to come and make their screening. Another one is statistics.
Yes.
How we make sure that every single contact with citizens are recorded, and there's a central digitalization system that records everything and making sure that the positive results are there positive, a true positive, not a true or a false negative or a false positive. And then how are you going to refer all these patients detected, and we detected 2.5 million, to tertiary units to get their treatment. And then another success story is the treatment used to be a very expensive treatment. Before, in 2015, for example, it was 120,000 Egyptian pounds.
Yes.
Currently, it's 3,000. So we achieved a very good deal. Again, localization for the medications, technology transfer from the multinational companies to Egypt, and currently we are manufacturing all the hepatitis C medications. And hence, we have a very good traffic for medical tourism, hepatitis C patients coming from England, for example, and from the Gulf to get their treatment here, because it's much, much cheaper, it's of high quality, and they can do their touristic
Tourism
side
as well, yes.
as well, beside getting their treatment. Another thing is how you make sure that you're not going to be having a reinfection. So you need to focus on the public health, on the hygiene techniques, on the hygiene of the Egyptian citizens, and making a lot of public awareness campaigns. And hence, and because of that, last October, after the screening, we made sure that we do have a less than 1%. We are on our way to eliminate it to 0%, and hence we got the golden tier in our road of elimination of virus C by the WHO.
Yes, Dr. Islam, allow me to be going to the other report of the daily debate for tonight, which focuses on the investment or pumping of money. About 9.4 trillion Egyptian pounds were pumped into the mega national projects over the past decade under the tenure of President Abdel Fattah al-Sisi, according to the statements made by Prime Minister Dr. Mustafa Madbouli. We will be having more details regarding such a statement and quite an achievement in the upcoming report. Stay tuned.
Prime Minister Mustafa Madbouli said the state has attained unprecedented achievements in all spheres throughout more than 10 years. The Premier was speaking at the Story of Homeland Between Vision and Achievement conference held last September in the presence of President Fattah al-Sisi. Madbouli said it's a great honor and enormous responsibility to be standing today to review achievements made by the state over more than 9 years in all domains to serve citizens. He added that such achievements are unprecedented and have never been witnessed since centuries. The Prime Minister said the global economic crisis has caused massive challenges, leaving all world countries, especially the developing ones, suffering inflation and hiking prices. Madbouli said that the success stories of developed countries prove that development has been their top priority and a solution to their problems. He added that setting up projects, adopting an ambitious national strategy alongside boosting the expenditure is key for ensuring development of nations. Prime Minister said that achieving real comprehensive development required improving the economic growth rate with a view to creating job opportunities, providing social protection nets for the low-income segments, promoting partnerships with the private sector, minimizing the state's role in economic activities. He pointed out the challenges posed by the outbreak of coronaviruses in 2020 and the rising global inflation rate has pressed the state to work amid consecutive crises. Madbouli pointed out to the state's urban development for the year 2050, highlighting that the plan was outlined by 34 Egyptian experts and consultants in all domains to make a proposal on the method of building a successful state. The state has introduced 6 tracks for achieving development, including improving infrastructure, ensuring integration in the global economy, attaining food security, and adopting social protection programs.
Welcome back. You're still watching the Daily Debate, and I am honored to be having with me over the program for tonight Dr. Islam Anan, the lecturer of health policy and health economics at Ain Shams University. Thank you very much once again for being with us tonight. We have seen over the past report the achievements made in general in the state under the tenure of President Abdel Fattah al-Sisi, but one of them in the sector of health is the comprehensive health insurance system, or the universal health insurance system. How important is it to be having the idea itself of implementing it in several governorates, maybe small governorates, but we have at least the idea being implemented and propagated for the future in bigger governorates all over the state?
So again, previously, before having a universal insurance system, we had a multiple insurance umbrellas.
Yes.
So the Egyptian citizens got multiple hats for insurance. Some of Egyptians got insurance under health insurance, another under own state fund, another for private sector. So we didn't have what we call a health equity. And one of the main important objectives of the healthcare system in Egypt and in our 2030 vision is health equity. So all Egyptians are treating the same. All Egyptians got the right for treatment and reaching their treatment. Having said that, we need to have one system, eliminate all the old systems and replace them with a new one. And hence, the pilot started in Port-Said to have the pilot of one universal insurance, eliminating all the other sectors. And it's actually been very successfully reaching all the patients and having accessible and equitable access, which is very important, to all the medications and having a measured, standardized healthcare
so
provider.
This has been done already
In Port-Said, and then currently in 5 governorates. And year after year, we'll be adding 3 to 4 governorates till we reach 2032. By 2032, we will involve Cairo.
which is the main problem.
20 million.
Yes.
It's a country on its own. So it will be the last governorate. But we are actually having solid steps, milestones year after year. And this year we are actually the UHIE, the Universal Health Insurance, entering the more than 1 million governorates, which is the tough competition. It's another pilot. And the infrastructure is actually built already. So we are having a solid pace there. And we are putting a lot of key performance indicators as well, that we are achieving that in the other governorates, having done the pilot in the 5 governorates and learned the challenges, how can overcome it from procurement, from supply chain, from warehouses. I mentioned in the report that currently we do have what we call a strategic warehousing to make sure that we don't have any disruption in terms of supply and so on. Inshallah, we'll be meeting here year after year.
Yes.
Year after year, we'll be achieving 5 to 6 governorates, 3 to 4 governorates, as I mentioned, till we achieve the big governorates in the Delta region.
Yes, and Doctor, my final question would be about the same note that we have begun the episode with, which is investing and the private sector being an investor, a potential investor in the health sector. What are the incentives that the government, that the political leadership should be offering for the potential investors to be coming and pumping more money into the health field here in Egypt?
Thank you. That's a continuation to my previous answer.
Yes.
We are going to universal health insurance. We are more than 100 million citizens. That's an incentive on its own. It's a big population, the most populous country in the Middle East and Africa, excepting, of course, Nigeria. So having a lot of resources for any investor to invest, having as well a very touristic place that people will be seeking for medical tourism as well. And we do have a well-trained healthcare professionals. So they do have the human resources. They do have the place where actually it's a desired place for any tourist or medical tourism. And we do have a political will from the government that we can give the investors advancement in terms of entering the health insurance organization, in terms of taxation, for example, in terms of competition and a fair competition with the public sector. Involvement in the healthcare system itself is an incentive for them. So it's all there. The infrastructure is there. As we were saying, they will just do facelifting to an existing infrastructure. So I believe it's a very good incentive for any investor to invest in healthcare here. And that's why from 2018 to now, every year we have billions of Egyptian pounds pumped and injected in healthcare from foreign investment.
Yes, for the benefit of the citizens. At the end of the day, Dr. Islam Anan, the lecturer of health policy and health economics at Ain Shams University, thank you very much for being with us tonight.
Always a pleasure. Thank you.
Happy Ramadan.
Happy Ramadan.
Anytime. And this brings us to the end of the daily debate for tonight. I will be leaving you, however, with a report about the presidential activities of His Excellency President Abdel Fattah al-Sisi, all in the upcoming reports, so stay tuned. Thank you for watching and goodbye.
President Abdel Fattah al-Sisi meets with the Secretary General of the United Nations, Antonio Guterres. The meeting is attended by the Commissioner General of UNRWA, Philippe Lazzarini, and the UN Resident Coordinator in Egypt, Elena Panova. The meeting addresses many international and regional issues, with emphasis on developments in the Gaza Strip. President Abdel Fattah al-Sisi meets with Prime Minister Dr. Mustafa Madbouli, Minister of Finance Dr. Mohammed Maid, and Vice Minister of Finance for Fiscal Policies Ahmed Koukchouk. Spokesperson for the presidency, Councillor Dr. Ahmed Fahmy, says the meeting reviewed the draft budget for the fiscal year 2024-25. President Abdel Fattah al-Sisi receives a U.S. congressional delegation led by Chairman of the Counterterrorism Law Enforcement and Intelligence Subcommittee, Republican Congress, August Pfluger, as well as members of the U.S. Congress from the Democratic and Republican parties. The meeting is also attended by Foreign Minister Sameh Shoukry and Director of the General Intelligence Service, Major General Abbas Kamel. During the meeting, the two sides underscore the robust and firm strategic partnership between Egypt and the United States. President Abdel Fattah al-Sisi reviews work progress in the Egypt's Future project in the New Delta, which aims to provide high-quality agricultural products at affordable prices for citizens and to export the surplus.